my name is student nurse Linda Wihlintini, and I'll be doing a postpartum examination on a woman post-labor. I'll start off by screening to ensure patient privacy, and I'll wash my hands and I'll go to the patient. Good day, ma'am. What is your name? Can you please confirm it with your ID belts? And also confirm with her file to ensure that I am doing the procedure on the right patient. I'll wear my gloves because I will be dealing with bodily fluid and we don't want cross-contamination with the patient. I'll start off by checking my patient's file and check prescription and vital signs and see if there was any pain medication prescribed. Ma'am, do you feel any pain? And she said no, and I checked the prescription and I see that the pain medication was given as prescribed, and her vital signs need to be in normal ranges. The normal blood pressure is 120/80, 20 up and down for both systolic and diastolic, and the pulse has to be between 60 and 100. When she experiences hypotension and tachycardia, there might be a query of infection or hemorrhage. I'll start off by checking for anemia, ma'am. Can I please see your eye? And I'll also check her buccal mucosa. And ma'am, may you please stick out your tongue? There's no signs of anemia there. I'll also check peripherally if there's any cyanosis, if she's blue, if the hands are warm. Thank you, ma'am. Now I'll check your breasts, ma'am. You have to expose your patient minimally. Do you feel any pain on your breasts? I'll also check for the temperature for both breasts. You have whatever you do on one breast, you must do on the other. You must check the type of nipples that she has, the symmetry and placement of the breasts, and check by the nipple and areola if there are any bruising or lacerations. This may be a sign that she is not breastfeeding properly and the baby is not latching on well. And this may cause pain, which will cause her not to want to breastfeed. And we'll also check if she is lactating, if there is milk coming out from both breasts. Thank you, ma'am. Next, I'm going to check your abdomen. I'll check for your uterus to see if it's contracted. It might be a bit uncomfortable for you, but we have to see that there are no abnormalities. For her uterus, we will see if she had a C-section. We'll check the wound. The site of incision must be dry. The dressing must be dry. There mustn't be any gaping, pus, or bleeding. And we also have to check for the fundal heights. You go to the supports at the base of the abdomen and go to the umbilicus and feel for the uterus. It has to be as hard as a tennis ball. That's when you know it is contracting well, and you also have to measure the fundal heights. And check for the bowel sounds. There should be normal bowel sounds postpartum. And you must encourage, ma'am, may you please to eat. Ma'am, may you please eat so that you have enough energy to take care of the baby and so that you can breastfeed. And when last did you go to the bathroom to urinate? May you please try by all means to go urinate every 2 to 3 hours. And this, by urinating, it also helps with the contraction of the uterus. Next, I'll check for the lohia. And I'll check the pad. When last, ma'am, did you change your pad? And with this information, you can tell whether she is experiencing antepartum hemorrhage, because if the pad is full and she just changed it, it means she is experiencing that. And you also check if there are any clots, ma'am. When you go change your pad, do you see any clots by any chance? Small clots the size of a penny or a coin are normal, but clots that are as big as an egg are not normal. If she had a normal birth, you check by the episiotomy site, if it is intact, if there's no bleeding. Check the vaginal area if there are any lacerations, scars, if there is any abnormal discharge or any foul smell. You also check by the rectal side for any hemorrhoids. and encourage her to go for defecation. Ma'am, may you please try to go and do number 2. Next, you will expose her legs and check for deep vein thrombosis. Ma'am, may you please relax your legs and lift it by the knee and hyperpedal flex. Do you feel any pain when I do that? If she says yes, it means that she might be experiencing DVT, but you can't just rely on that. You have to check if there's any redness, swelling, and also check for her pedal pulses and for any edema. What I do on this leg, I also have to do on the other leg. Do you feel any pain, ma'am? I also check for any redness, swelling, check her pulses, and for pitting edema. Thank you very much, ma'am. I'm done with my examination. Do you have any support home for caring for the baby? By asking this, I'm checking for emotional status. And when I bring the baby, you also observe how she's interacting with the baby. If she's leaving the baby to cry alone and not attend to it, or if she's interacting with the baby. This may be a sign of postpartum depression, and mothers that are experiencing such should be referred.
Good morning.
How are you?
I'm well, and yourself?
Well, thank you. I'm student nurse Ntini. I'm here to give you health education after giving birth.
Okay.
May I please have your name and surname?
My name is Celia Mudipa.
Here I'll check with her file. Celia Mudipa. Can I please see your ID belt? It also says Celia Mudipa. Okay, so ma'am, today I'll be educating you about how you will get better and the normal processes and how you can better care for the baby. Okay, so for you, you will be experiencing bleeding, like what you're currently experiencing now. Did you have a normal vaginal birth, or did you have a cesarean section?
A normal vaginal birth.
Okay, thank you. So you will be bleeding bright red blood, and you should change your pad between 2 to 3 hours. And when you change your pad, you should look and see how much blood is on the pad. The blood will be bright red, and if it is a lot, you should report to us, because that may be a sign that you are over bleeding.
Okay.
After 3 to 5 days, the blood will turn dark brown, which is normal, which is showing that you are healing and there's less bleeding going on. And after that, it's just a discharge that you normally see on your 8-day living, which is whitish. And your uterus will be contracting because it was big because of the baby inside. Now it will be going back into normal. So it will be doing what you call contracting, which you may experience a bit of pain from that. So you should do a couple of exercises so that you can get your post-baby belly back. And we will show you some of those exercises. A few sit-ups, walking also helps. Something we call a log roll that you can also do to help yourself to get back into shape.
Okay.
Your breasts may feel tender. And are you going to breastfeed your baby?
Yes.
Okay, so when you're breastfeeding, it is important for you to help the baby latch on properly on the breast. Because if the baby is not putting their mouth properly on the breast, it may hurt you. And breastfeeding is not supposed to hurt. And when it hurts, you might end up getting cuts, which will cause an infection, which is not good, obviously, for you and the baby as well. And you must ensure that your breasts are always clean, and you don't wear bras that are not for breastfeeding, so that you can ensure that you are comfortable. So for your delivery, did you get any stitches?
Yes.
Okay, for the care for those stitches, you can use coarse salts, put it in lukewarm water in the bath, and then sit in the bath. This ensures that they are clean and they dry up, and then you heal earlier. So you can do this for 3 to 5 times a day to ensure that your stitches heal and they dry up, and then you get better earlier. And you must also avoid sexual intercourse for the first 6 weeks. And the reason for that is you are still very tender and in pain, and your stitches may need restitching, and some stitches we can't restitch, which is also a complication for you. So we need you back in your post-baby state as early as possible. So you have to do all those things. Okay, now for the baby, you must ensure that you do skin to skin with the baby. This promotes bonding, and it's also easier to breastfeed while you are doing skin to skin with the baby. So you remove your top and ensure that the baby is also not wearing anything. You don't have these nice lotions that smell strongly and perfumes. You just bare and clean, and put your baby to your chest and sit comfortably and have just a blanket over the baby. So the baby will bond with you, and you can also breastfeed while you are doing that. And the baby, you must breastfeed on demand. So when you see the baby is not sleeping well, the baby is crying a lot, try giving the baby the breast. The baby might just be hungry. And ensure that you also breastfeed between 2 to 3 hours, and also on demand, because the baby might not have been full from the previous feeding. And the baby, you must, with every nappy change, you must clean the umbilical cord with surgical spirits. That ensures that it dries up with no infection, and it can fall off earlier. So if you see excessive bleeding from the umbilical cord, any pus, that yellow stuff on the umbilical cord, you must take the baby so that they can check at the clinic, your nearest clinic, or at the hospital. There might be a problem. And you must check the color of poo that the baby is pulling and how hard or soft it is. You can show that the baby might be having belly problems, or the baby might be constipated, because we all get constipated, right? Yes. And take the baby for immunizations. Immunizations, you have a Road to Health card. They tell you the date for your next return, and it is important that they can give those immunizations. And when you go for these immunizations, you may also want to get contraception to ensure that you space your babies. There must be at least between 2 to 3 years between your babies, because you need to help heal as well. So if you have babies too frequently and you haven't healed properly, you might not have a smooth pregnancy, and it's very strenuous on you as well, because pregnancy is not easy. Labor is also not easy. So there are different types of contraceptions. You have injections for 3 months and 2 months. You have an implant that stays in for 3 years. You have a loop that goes inside, an IUD loop, and you have oral pills. And for the pills, there are certain types that you get because you are breastfeeding. They will